Hi, this is Dr. Rajeev Sharma. Today we will talk very important topic dyspepsia, that is difficulty in digestion. Most important symptoms of dyspepsia are postprandial fullness, epigastric burning, epigastric pain and early satiation. Apart from that, other important symptoms are belching, bloating, nausea and also recurrent vomiting episodes. Causes being mostly functional cases. Apart from that, food intolerance, gastroesophageal reflux disease, Peptic ulcer disease, which involves gastric ulcer, duodenal ulcer, very important cause of dyspepsia, GI malignancies, infections, gastroparesis secondary to diabetes mellitus, inflammatory bowel disease, that is Crohn's disease, and irritable bowel syndrome. Drugs such as acids, alcohol, iron therapy, and steroids is the most important culprit. So pancreatobiliary malignancies, also important factor for dyspepsia. Apart from that, gallbladder stone, chronic pancreatitis, and systemic disorders such as diabetes, thyroid disorders, kidney failure, heart failure and physiological conditions such as pregnancy should also be ruled out. Important pathophysiological factors causing dyspepsia are delayed gastric emptying, impaired gastric accommodation, hypersensitivity of the stomach to the distension, altered duodenal sensitivity to the acid. Certain genetic predisposition is very important cause that is causing dyspepsia, such as GNB3 gene is involved. Apart from that, very important infection, Helicobacter pylori, which is most prevalent in developing countries, almost 80% prevalence is there. That is important cause of the dyspepsia. Post-infectious causes such as typhoid should also be ruled out. Last but not least, very important cause, stress, anxiety, depression, post-traumatic stress disorder, that is very important cause of the dyspepsia. So regarding dyspepsia, most important is diet history. History is relevant. So diet history, lifestyle, what kind of the life person is having. Most important cases of the dyspepsia, we should rule out the alarming features such as significant weight loss, jaundice, anemia, lymphadenopathy, as well as recurrent vomiting. Age more than 45 years, that is alarming symptom for the dyspepsia, and you should rule out malignancies by doing upper GI endoscopy. Lab tests should be advised such as CBC, liver function test, kidney function test, serum calcium levels, as well as thyroid and sugar. So the most important, upper GI endoscopy, we should test for H. pylori infection. Apart from that, empirical therapy can also be given, and then later on endoscopy can be planned. So endoscopy is the gold standard test to rule out any kind of the erosions or ulcers which are lying there in the stomach or duodenum. And also we should rule out GI malignancies, as we have seen their alarming symptoms, especially in age above 45 years. So test and treat for H. pylori is the foremost approach. We should rule out peptic ulcer disease as well as gastric cancer, and 2-week triple therapy for H. pylori is advisable. And if it is negative, suppose H. pylori, then trial of PPI can be given. So treatment of functional dyspepsia is of utmost importance, especially in OPD patients. Psychiatric therapy should be advised. First and foremost thing is diet and lifestyle modification. Apart from that, drugs. Patients should be advised less tea, less coffee. They should avoid fatty meals, smoking, alcohol, and especially in high prevalent areas like where H. pylori is more than 20%, you should go for endoscopy. That is most important. So acid suppression drugs such as proton pump inhibitor, that is the best therapy that suppresses the acid for more than the clock. Apart from that, previously we used to give H2 receptor blockers such as cimetidine, ranitidine, but nowadays PP has scored over the H2 receptor blocker. Apart from that, prokinetic agents such as domperidone also can be given if postprandial fullness is there. So best thing is reassurance, dietary lifestyle modification, then test and treat policy. Trial of PPI can be given if patient is not willing for endoscopy for 2 to 4 weeks. If symptoms still persist, advise endoscopy, and also add psychiatric medications such as antidepressants and anxiolytics if patient is not getting symptomatic relief. If there is no improvement, then again you should go for H. pylori treatment. You can go for first line therapy in H. pylori treatment. If H. pylori eradication is not there, then you can also go for the second line regimen for the H. pylori. So upper GI endoscopy is advisable, especially you are having reflux symptoms, peptic ulcer disease, and also to rule out GI cancer. So don't get panic, have stability in the life, and you can fight easily this dyspepsia. You don't need to be worried about. Consult your doctor for such symptoms and get relief as soon as possible. If you are having any doubts, kindly ask me. Thanks for watching.